The handouts or review materials must be treated with utmost confidentiality. It shall be the responsibility of the person whose name appears therein that the handouts or review materials are not photocopied or in any way reproduced, shared, or lent to any person or disposed in any manner. Any handouts or review materials found in the possession of another person whose name does not appear therein shall be prima facie evidence of violation of RA 8293. Top-notch review materials are updated every 6 months based on the current trends and feedback. Please buy all recommended review books and other materials.
Good day, everyone. This will be your main lecture on anatomy and histology. I am Dr. Jed Lianes, and I will be discussing the head, neck, and the thorax. So starting with the head. First, we have the skull. So the skull can be divided into two parts. You have the cranial part and the facial part. The cranial part is made up of two paired bones, the parietal and temporal bones. So here you have the parietal bone and the temporal bone. And you have four unpaired bones. You have the frontal, the sphenoid, the ethmoid, and the occipital bones. You also have 14 facial bones. 6 of them are paired and 2 of them are unpaired. So here you have the palatine hidden dyan sa loob. Then you have the lacrimal. Then the maxilla, this one in yellow. You have the nasal bone, this one in pink. You have the inferior nasal concha, itong light green sa loob. So remember, the inferior nasal concha is a separate bone. And you have the zygomatic, this green one. And you have two unpaired bones. You have the vomer right here in the middle. And you have the mandible. So for some skull landmarks, first you have the bregma, which is a junction of the coronal and the sagittal suture. So this is the bregma. You have the lambda, which is a junction of the lambdoid suture, this one, and the sagittal suture. So lambda. You have the terion, which is a junction of the frontal, temporal, parietal bone plus the greater wing of the sphenoid here. And you have the asterion over at the posterior part of the skull, which is a junction of the parietal, the temporal, and the occipital bones, so over here. And the nasion is over here, which is a junction of the frontal and nasal bones. When you open the skull base has 3 cranial fossae. And these are divided into the anterior fossa, the middle fossa, and the posterior fossa. And these are separated by the lesser wing of the sphenoid and the petrous part of the temporal bone. And you can see here the colors indicate what bone is part of which fossa. So let's first go to the anterior cranial fossa. Some important structures that can be found in the anterior cranial fossa is the cribriform foramina, which is on the cribriform plate. So this is the cribriform plate, and it has tiny holes, which are the cribriform foramina, which allow passage of cranial nerve 1. You also have the foramen cecum over here, which transmit the nasal emissary veins. Another important structure to be found here is the crista galli of the ethmoid bone and the frontal crest of the frontal bone, which provides attachment for the falx cerebri, which is a meningeal extension of the dura mater. So next you have the middle cranial fossa, and here you can see the optic canal, which transmits the optic nerve, the ophthalmic artery, the central artery, and vein of the retina. Followed by the superior orbital fissure over here, which transmits the cranial nerves for the extraocular muscles. So you have the oculomotor, trochlear, and abducens nerve. And you have the first division of the trigeminal nerve, or the ophthalmic nerve, or cranial nerve V1, and the ophthalmic vein. Behind this, or posterior to this, you have the foramen rotundum, so rotundum to It transmits the second division of the trigeminal nerve, the maxillary nerve. And the posterior to this, you have the foramen ovale. So that's 3, ovale. So it transmits the third division of the trigeminal nerve, the mandibular nerve. It also transmits the accessory meningeal artery and the lesser petrosal nerve. Laterally and posteriorly, you have the foramen spinosum, which transmits the middle meningeal artery, which is very important when it comes to head trauma, as we'll discuss later. And you have the foramen lacerum. So the foramen lacerum over here, tingnan nyo, mukha siyang lacerated. Yun lang yung palatandaan ko, mukha siyang lacerated dyan sa likod. It is traversed by the internal carotid artery and the greater petrosal nerve. So, pag tinanong, it does not transmit, or the internal carotid artery does not pass through this foramen. It's just traversed by it. Lastly, you have the posterior cranial fossa. So first, you have the internal auditory meatus. So the internal auditory or acoustic meatus over here transmits your facial nerve and your vestibulocochlear nerve, and also the labyrinthine artery. Next, you have your jugular foramen. So for the jugular foramen, it transmits your cranial nerve 9, 10, and 11. So your glossopharyngeal, vagus, and spinal accessory nerve. So for the jugular foramen, it only transmits the cranial root, not the spinal root of cranial nerve 11. You also have the internal jugular vein. Next, smaller to the jugular foramen, more medially, you have the hypoglossal canal. So the hypoglossal canal, of course, transmits the hypoglossal nerve. And lastly, the biggest part of this whole posterior cranial, the biggest foramen in this whole posterior cranial fossa, you have the foramen magnum. So dito natatransmit yung spinal root ni spinal accessory nerve. It also transmits your spinal cord, your vertebral arteries, your venous plexus of the vertebral canal, and the anterior and posterior spinal arteries. So, this is just a summary slide for all the important foramina or apertures that can be found in each of the cranial fossa and their contents. Yung isang palatandaan ko dito, kapag tinatransmit niya yung nerve, it most likely also transmits the arteries and veins involved in that organ that they are innervating, or that part that they're innervating. So, kunwari, yung internal acoustic meatus, di ba nga, ang tinatransmit niya ay yung vestibulocochlear nerve. At alam naman natin na yung vestibulocochlear nerve siya yung sa vestibule at yung cochlea. And, di ba, labyrinth yung tawag dun sa area na yun. Kaya tinatransmit niya si labyrinthine artery. So, pwede kayong gumawa ng mga correlations na yon para hindi masyado magulo kapag tinignan niyo to yung mga ganitong table. Okay? So, some other cranial foramina na wala naman dun sa skull base. So, you have, ito yung sa face. So, you have the supraorbital foramen. So, over here, above the orbital rim. So, it transmits the supraorbital nerve, which is a branch of the frontal nerve from the ophthalmic nerve. Okay? And it also transmits the supraorbital artery and vein. So, dito naman sa baba, nasa may ilalim ng orbital rim, it's the infraorbital nerve, which is now naman a branch of the maxillary nerve. So, supraorbital from ophthalmic, infraorbital from maxillary. So, pag tinignan mo naman yung, pag tinanggal mo yung mandible, tapos tinignan mo siya from below, yung skull, makikita mo dito yung stylomastoid foramen. So, yung stylomastoid foramen, by its name, malapit siya sa styloid process at saka sa mastoid process. So, ito siya, yung itong butas na to dito. Yan. Yan yung stylomastoid foramen. And important siya kasi it transmits your cranial nerve 7, so palabas ng skull, and the stylomastoid artery. Sa jaw naman, or sa mandible, ano yung mga foramen? So, you have the mental foramen. So, the mental foramen is anterior and exterior. So, ito siya. It transmits the mental nerve, which is a branch of the inferior alveolar nerve, which is a branch of the mandibular nerve. So, yung mandibular foramen naman, nasa posterior siya, nasa may ramus ng mandible. and it's interior. So the mandibular foramen, ito yung nagtatransmit ng inferior alveolar nerve, which is a branch of the mandibular nerve. And it also transmits the inferior alveolar artery and vein from the maxillary artery and vein. So let's just talk about some clinical correlations. So skull fractures. Depende sa site ng fracture, merong ma-affect na structures at syempre mag-iba yung presentation. So if you have a skull fracture of the anterior cranial fossa, di ba nandun yung cribriform foramina kung saan dumadaan ang olfactory nerve. So kapag naapektuhan yun, pwede ka magkaroon ng anosmia. And dahil nandun sa area ng nose or nasal cavity, pwede kang magkaroon ng CSF rhinorrhea. Pwede rin magkaroon ng periorbital bruising kasi nandito siya sa may anterior where you will have your raccoon eyes. Kapag naman yung temporal bone yung affected, maraming nerves and vessels na matatamaan. So, cranial nerve 7, 8, 9, 10, 11, internal carotid artery, tsaka yung petrosal and sigmoid sinuses. So, dun sa area na yan, pwede kang magkaroon ng CSF and or blood otorrhea, hearing loss, facial nerve damage leading to facial muscle paralysis, and yung battle sign. So, yung battle sign, yun yung may bruising over the mastoid process. And lastly, for maxillofacial fractures, we use the Lefort classification. So, pag C1, isang diretsong linya lang siya sa may maxilla. Pag C2, para siyang dalawang linya na nag-converge. And pag C3, ito yung tandaan niyo, siya yung pinakamalala. Siya yung complete craniofacial dislocation. So, parang yung buong face na dislodge from the skull. So, pwede siguro siyang isipin na 3. 1, 2, yung across, tas yung 3 yung pa sa gilid. So, parang medyo makikita mo yung numbers dun sa kung paano nag-form yung fracture. So, dahil facial fracture siya, magkakaroon ka ng facial swelling, malocclusion of the teeth, diplopia, and pwede ka rin magkaroon ng CSF rhinorrhea. Next, you have the scalp. So, the scalp is actually an acronym for its layers. So, you have skin, connective tissue, aponeurosis, loose areolar tissue, and the pericranium. So, nakalagay din dito kung ano yung mga characteristics. Ang important dito ay nasa aponeurosis ang epicranial aponeurosis kung saan nakadikit ang dalawang muscle na important. You have the occipitalis and the frontalis. So si frontalis, important siya kasi siya yung nag-insert sa skin of the eyebrow and the orbicularis oculi, and it causes you to raise your eyebrows or yung nagpag-wrinkle ng forehead. So again, yung aponeurosis, nandyan si epicranial aponeurosis kung saan nakadikit si frontalis and si occipitalis. For another important structure na nakikita or na related sa scalp ay yung emissary veins. So yung emissary veins, located siya sa loose connective tissue. So yung fourth deepest layer ng scalp. And it's important because it connects the cranial venous sinuses to the extracranial veins. So ito yung emissary vein, nakikita mo ito yung dural venous sinus, tapos nakakonect siya dito sa extracranial vein. It actually helps to keep pressure in sinuses constant. So kapag tumaas yung pressure dito, may outlet yung blood or may outlet yung pressure palabas papunta sa scalp. But another thing is that it actually provides a route for intracranial spread of infection. So kung may scalp infection ka, pwede naman siyang pumasok paloob. So now we go to the meninges. So the meninges are below the so underneath the scalp. Tapos papasok pa after the skull, you have your dura mater, your arachnoid mater, and your pia mater. So starting with the dura mater, you have two layers. You have the endosteal layer and the meningeal layer. So the endosteal layer is not continuous through the foramen magnum with dura of the spinal cord. While for the meningeal layer, ito yung tinatawag na dura mater proper. So ito yung continuous with the dura of the spinal cord. So from dadaan sa foramen magnum, tuloy-tuloy na siya sa spinal cord. So the dura mater has several extensions nakaturo dito. So first you have the falx cerebri. So remember when we say falx, it actually means sickle-shaped. So etong buong to, it looks like a sickle. And it lies at the midline between the two cerebral hemispheres. So hinahati niya into left and right hemispheres, yung cerebrum natin. Then it is narrow. The narrow anterior end is again attached dun sa dalawang structures na nabanggit natin kanina, the crista galli of the ethmoid bone and the frontal crest of the frontal bone. Next, you have your tentorium cerebelli. So itong tentorium cerebelli na to, ito yung itong area na to. So it's a crescent-shaped fold, and it forms the roof of the posterior cranial fossa. So, ito yung roof. So, dapat nandito sa area na to, yung posterior cranial fossa. So, it supports the occipital lobes of the cerebral hemisphere. So, parang nakapatong doon. So, kung ito yung tentorium cerebelli, nakapatong doon yung occipital lobes. And then, you have your falx cerebelli. So, kung si falx cerebri, hinahati niya si cerebrum. Si falx cerebelli, hinahati naman niya si cerebellum. Then, lastly, you have your diaphragma sella, which covers or forms the roof of the sella turcica, kung saan nakahouse ang pituitary gland. So, for the neurovasculature of the dura mater, remember that the dura mater is sensate, so meron siyang nerve supply. Yung sensory supply niya above the tentorium cerebelli is from the trigeminal nerve. Yung sa below, it's from the first three cervical nerves. Ano yung importance nito? Kapag may problem ka above the tentorium cerebelli, yung headache niya ay referred to the forehead and the face. Kapag naman below the tentorium cerebelli, which is nandun yung cerebellum, yung midbrain, etc., yung headache ay referred to the back of the head and the neck. So for the blood supply, it's the middle meningeal artery. Saan uli lumalabas si middle meningeal artery? Sa foramen spinosum. So yung palatandaan ko doon, yung spine, may meninges. So lumalabas sila spine, spinosum, meninges, middle meningeal artery. And yung venous drainage niya ay yung middle meningeal vein. Next, you have your arachnoid mater. So it's impermeable. It adheres to the deep side of the dura. So actually, itong space na to, wala talaga yan. And it projects into the venous sinuses to form the arachnoid villi. And lastly, you have the pia mater. Kung si arachnoid mater, nakadikit siya sa dura, si pia mater, siya naman yung nag-i-invest sa brain. And it's vascular. So it covers the gyri and descends into the deepest sulci. So gyri, so ito yung gyri. Yan, yung bundok. Yung sulci, yan yung valleys. And it extends over the cranial nerves and fuses with the epineurium, so layer na nung nerves. So nabanggit na natin, no, may mga meninge na magkakadikit sa isa't isa, pero meron din mga spaces, and some of these are actually potential spaces. Meron din naman actual space. So first, we'll talk about the extradural space. So it's between the inner aspect of the skull bone and the endosteal layer of the dura mater. So ito yung dura mater. So yung extradural space ay dito. Yan, dito sa area na to. Subdural space is also a potential space. It's between the dura and arachnoid mater. So again, yung arachnoid nakadikit talaga siya sa dura. So ang subdural space ay dito. Yan, itong area na to. Again, potential space siya. And last, you have the subarachnoid space, which is an actual space that's filled with cerebrospinal fluid. And it's found between the arachnoid and pia mater. And it contains your blood vessels that supply the brain. So let's go to the brain. So the brain, the central nervous system differentiates from the neural tube. So at the 3rd to 4th week, the neural tube becomes the 3 primary brain vesicles. So you have the prosencephalon, which is the forebrain, the mesencephalon, which is the midbrain, and the rhombencephalon, which is the hindbrain. Pagdating ng 5th week, the primary brain vesicles developed into the secondary brain vesicles. So si prosencephalon, magsisplit siya into a telencephalon and the diencephalon. Si mesencephalon midbrain, magiging mesencephalon pa rin. Si rhombencephalon, magdi-divide siya into your metencephalon and your myencephalon. And these secondary brain vesicles become the adult brain structures. So si telencephalon, dyan na si cerebrum, kasama dyan si cortex, white matter, basal nuclei or basal ganglia. Si diencephalon, yan yung magiging thalamus, hypothalamus, and actually pati yung retina, part ng diencephalon. Si mesencephalon, that's gonna be your midbrain. Your metencephalon will become the pons and your cerebellum, while your myencephalon will become your medulla oblongata. And each of these adult brain structures is associated with neural canal regions. So, di ba, ito yung neural canal. Tapos magde-develop siya dito sa mga to, sa areas na to. And so, yung associated sa cerebrum are your lateral ventricles. Ang associated sa diencephalon is your third ventricle. Ang associated sa Mesencephalon hanggang sa mesencephalon, sa midbrain, ay yung cerebral aqueduct. And yung associated sa rhombencephalon or the meten and myencephalon is your fourth ventricle. So now let's discuss the anatomic levels of the nervous system. So you have the supratentorial level. So kanina 'di ba iba na nga yung innervation ng dura kapag above the tentoriums below. So ganun yung system in such a way na nakahati din yung anatomic level above the tentorium cerebelli and below. So supratentorial level, it has your cerebrum, basal ganglia, thalamus, hypothalamus, cranial nerves 1 and 2. So basically, your prosencephalon. Infratentorial, nasa posterior fossa level, but above the foramen magnum, andito na yung rhombencephalon mo to your myencephalon. So cerebellum, brainstem, kasama yung midbrain, pons, medulla, at nandito yung rest of the cranial nerves. Below that, so below the foramen magnum, but within the vertebral column, so nandito siya sa loob lang nitong area na to, is your spinal level. So it has your spinal cord, spinal nerves with the vertebral column. And lastly, you have the peripheral level. So it's the neuromuscular structures located outside the skull and outside the vertebral column. So kasama dito yung cranial nerves, kapag nakalabas na sila dun sa areas nila, and your spinal nerves and their peripheral branches. Let's go to the cerebrum. So the cerebrum can be divided according to anatomical area or functional area. Kapag anatomical area, we're talking here about lobes. So you have the frontal, parietal, temporal, and occipital lobes. Pero pwede ring i-describe according to functional areas, which are numbered areas using the Brodmann classification. For example, your primary motor area is located at the precentral gyrus of the frontal lobe. Pero sa Brodmann classification, it's Brodmann area 4. Si primary sensory area, it's at the postcentral gyrus ng parietal lobe, but it is also Brodmann area 3, 1, and 2. So each lobe will have its own function. Nabanggit natin kanina, di ba? Primary motor area nasa frontal lobe. So frontal lobe is the motor area including speech, motor speech. And it is also the seat of mental activities. So anything related to logic, judgment, etc. nasa frontal lobe yan. Parietal lobe is the somesthetic center, sensory. Occipital lobe is the visual center, while the temporal lobe is the hearing center. For motor neurons, we have upper and lower motor neurons. So for upper motor neurons, these are descending pathways in the cerebral cortex and brainstem. And these activate the lower motor neurons. So the lower motor neurons are the final common pathways for the control of skeletal muscle activity. So these include the motor cells in the spinal cord and the motor nuclei of the cranial nerves. Ngayon, kapag nagkaroon ng lesion dito sa upper motor or lower motor neurons, iba yung manifestation. So this table summarizes the differences. Basta kapag upper motor neuron lesion, kaya siya baliktad sa lower motor neuron lesion kasi usually the upper motor neurons provide inhibitory signals to the lower motor neurons. Kapag nawala itong inhibitory signal na to, free yung lower motor neuron to fire and basically fire signals to the muscles. Kaya kapag paralysis, spastic siya, tapos may clonus ka, very hyperactive yung reflexes mo, tsaka increased yung muscle tone. Kapag lower motor neuron, wala nang connection to the muscle. So, wala nang connection to the muscle, hindi magagalaw. So, flaccid yung paralysis, wala kang pathologic reflexes, wala kang clonus, and decreased yung muscle tone. One important thing na dinidiscuss is the Papez circuit. It is a circuit that ties together the cerebral cortex and the hypothalamus. And it provides an anatomic substrate for the convergence of cognitive activities, emotional experience, and expression. So it ties together the functions of the frontal lobe to the temporal lobe, etc. And it includes the hippocampus, the mammillary bodies, the anterior thalamic nucleus, the cingulate gyrus, the entorhinal cortex, back to the hippocampus. Next, we go to the thalamus. So the thalamus has several thalamic nuclei, and each of the thalamic nuclei have their own functions or relay. So ang thalamus is the primary relay center of the brain. So each of the nuclei will receive signals from different parts and relay it to different parts of the cortex. So yung ventral posterolateral nucleus, for example, receives signals from the spinothalamic tracts and the dorsal column. And alam naman natin, these function for sensory, so pupunta sila sa somatosensory cortex. Your lateral geniculate nucleus, for example, receives signals from the optic pathway, so papunta siya sa primary visual cortex. Middle geniculate, auditory pathway, papunta sa auditory cortex. One important thing to note is that olfaction is the only sensation that is not relayed to the thalamus. Diretso na siya sa cortex. Next, you have your cerebellum. So the cerebellum is divided into anterior, posterior, and flocculonodular lobes. The anterior is connected to the limbs via spinal connection. Yung posterior, it connects to the cerebral cortex. Yung flocculonodular, it connects to the vestibular apparatus. So dahil dito sa connections na to, very related yung connections na yan dun sa function. So limbs sa anterior, so coordination of limb movements, regulation of muscle tone. Si posterior, dahil nakakabit sa cerebral cortex, coordination ng voluntary movements. Kapag si vestibular pag si flocculonodular lobe naman yung pinag-uusapan, yung function niya kasi nakakonect siya sa vestibular apparatus, paraxial muscles associated with equilibrium. So kapag may lesions ka sa anterior, gait instability kasi yung limb movements mo affected. Voluntary movements ang posterior, so kapag may lesion ka, meron kang intention tremor. So intention tremor, yung kapag may gagawin ka with intention, dun lumalabas yung tremor. Parang yung finger to nose test. Pag naman flocculonodular lobe yung may lesion, dahil nga related siya sa equilibrium, tapos yung paraxial muscles yung kino-coordinate niya, truncal ataxia. So for the cranial nerves, you have 12 cranial nerves. Each of them have a specific name. And each of them will have a function, whether purely sensory, purely motor, or mixed. Tapos iba-iba rin sila ng entry or exit sa central nervous system. So, dito papasok yung mga mnemonics yung kung paano tandaan. Di ba, meron yung se, mo, mi, se, mi, mo. Yes. So, yung sensory dyan, yung olfactory and optic, and yung vestibulo-cochlear, yun yung purely sensory. For motor, you have the 3 cranial nerves related to the extraocular muscles, the oculomotor, trochlear abducens, and you have your accessory spinal and your hypoglossal. And the rest, trigeminal, facial, glossopharyngeal, and vagus, are mixed. Iba-iba rin sila nga ng CNS entry and exit, si olfactory sa telencephalon, sa cortex, sa optic, sa diencephalon. Si oculomotor and si trochlear ay parehong nasa midbrain. Si trigeminal ay nasa pons. Si abducens, facial, at vestibulocochlear nerves ay nasa junction between the pons and medulla. Sa medulla, si glossopharyngeal and si vagus. And sa spinal cord, si spinal accessory. And lastly, si hypoglossal sa medulla din. Next, you have your pituitary gland. Again, it's lodged in the pituitary fossa or the sella turcica of the sphenoid. Diba? Tapos yung bubong niya, si diaphragma sella. Ngayon, si anterior at si posterior, magkaiba sila ng pinanggalingan. Si anterior pituitary at posterior pituitary. Tandaan natin, si anterior, it's made up of your pars distalis, pars intermedia, and pars tuberalis. So, itong area na to. Tapos yung nakapalibot dito. Ngayon, itong 3 parts na to, ito ang galing sa Rathke's pouch. Yan, which is an upgrowth from the roof of the primitive mouth. So primitive mouth, it means it's endoderm. So endodermal derivatives itong si adenohypophysis. So pars distalis, intermedia, tuberalis. Kaya siya glandular epithelium. And then you have your posterior pituitary, which is the neurohypophysis. It's from the neurohypophyseal bud, which is a downgrowth from the diencephalon. So nerves siya. So it consists of nervous tissue. Ang part niya ay si pars nervosa, tsaka si infundibulum. So, si nervosa lang, yung sa mga pars, yung hindi part ng anterior. And subsequently, hindi siya galing sa Rathke's pouch. So, yung anterior and posterior pituitary, magkaiba rin ng sinesecrete. So sa pars distalis ng anterior, nandyan yung acidophils and basophils mo. So si acidophils nandyan nagsisecrete and nagpo-produce ng GH, prolactin. Sa basophils naman napoproduce and nagsisecrete ng FSH, LH, TSH, and ACTH. Sa pars intermedia, nandyan si MSH, melanocyte stimulating hormone. Pagdating sa posterior, tandaan natin na nagsisecrete lang sila. Hindi sila yung nagpo-produce. So sa pars nervosa, sinesecrete ang ADH and oxytocin. Again, nire-release lang kasi these are produced in the supraoptic and paraventricular nuclei of the hypothalamus. Arterial supply, medyo magkaiba din. Si anterior, it's just the suprahypophyseal. Si posterior, it's the suprahypophyseal plus the infundibular and the inferior hypophyseal, all of which are branches of the cavernous part of the internal carotid artery. We now go to your ventricular system, which consists of the right and left lateral ventricles, found in the cerebral hemispheres, the third ventricle, found in the diencephalon, the cerebral aqueduct, found in the midbrain, and the fourth ventricle, found between the cerebellum and pons or medulla. So, tandaan nyo lang yung embryology picture na nakita natin kanina. So, the ventricular system contains your cerebrospinal fluid produced by the choroid plexuses, lined by ependymal cells. Now, the flow of the CSF starts from the lateral ventricles. So, dito. Dadaan siya dito. Lateral ventricles. Tapos mag-meet siya dito through the foramen of Monro, the intraventricular foramen, to go to the third ventricle. So from the third ventricle, bababa na siya dito, papunta sa cerebral aqueduct. And from the cerebral aqueduct, pupunta na yung CSF sa fourth ventricle, dito. And from the fourth ventricle, meron siyang dalawang labasan. You have a paired lateral and one median aperture. So paired lateral, the foramen of Luschka, and yung sa median is the foramen of Magendie. Paglabas niya, mapupunta na siya sa subarachnoid space kung saan ibe-bathe niya yung central nervous system. And from the subarachnoid space, pupunta siya dun sa arachnoid granulations which absorb the cerebrospinal fluid into the venous sinuses. Next, let's go to the arterial supply of the brain naman. So for most of it, it comes from the internal carotid artery. So the internal carotid artery can be divided into 4 parts. So for the cervical part, wala siyang branch. For the petrous part, it gives off the artery of the pterygoid canal and the carotico-tympanic artery. So tandaan lang natin, petrous part of the temporal bone, andyan yung, nandun sa petrous part, yung cochlea and yung vestibule. So carotico-tympanic artery, so related dun, nandun siya. Next, you have your cavernous part. So, yung cavernous part, tandaan natin, yung cavernous sinus, nandun sa gitna nun yung pituitary gland. So, yung arteries na nagsusupply dun sa pituitary gland, dito na siya magba-branch off. So, you have your superior hypophyseal and your inferior hypophyseal. Tapos, meron ding meningeal branch. And then, you have your cerebral, which gives off 5 branches. Your middle cerebral, anterior choroidal, posterior communicating, and your ophthalmic. You also have your vertebral artery. So, si internal carotid, mas anterior siya. Si vertebral artery, mas posterior. So, si vertebral artery, it is actually a branch of the subclavian artery. The first part of the subclavian artery. Now, the vertebral artery ascends to the cranium via the transverse foramen of the first 6 cervical vertebrae. Tandaan natin na hindi dumadaan sa transverse foramen ng C7. Kung makita din sa picture na to, ayan, hindi dumadaan dyan si vertebral artery. Dadaan siya from C6 upwards hanggang C1. Now, these bilateral vertebral arteries now merge to form the basilar artery over here. Now, one very prominent feature of the arterial supply of the brain is the circle of Willis, which is made up of the anastomosis between the branches of the 2 internal carotid and 2 vertebral arteries. So, ito yung basilar artery, di ba? Galing siya sa vertebral arteries. Manggagaling sa vertebral artery, itong posterior cerebral artery. Si internal carotid naman, i-give off niya si anterior cerebral artery, tsaka si anterior communicating artery, tsaka si posterior communicating artery. And yung circle of Willis, kaya ang parts ng circle of Willis ay yung anterior communicating, the anterior cerebral, itong part na to na internal carotid, yung posterior communicating, and yung posterior cerebral artery. So, to summarize that part, so you have as yung arterial supply of the brain, meron galing sa internal carotid at meron galing sa vertebral. Sa internal carotid, ang dalawang branch na important would be anterior cerebral and middle cerebral. So, si anterior cerebral, sinusupply niya yung cerebral hemispheres except the occipital lobes. Si middle cerebral, in-supply niya yung most of the lateral surface of the cerebral hemispheres. So, si anterior cerebral actually sa mas midline na part ng cortex siya, or ng cerebral hemispheres. Si vertebral, sa kanya manggagaling si basilar. And etong part na to yung magsusupply sa brainstem, cerebellum, and cerebrum, yung sa likod na part. You have your posterior cerebral, which is the terminal branch of the basilar artery. So, siya yung nagsusupply sa occipital lobe. Then you have your posterior communicating, which actually gives arterial supply to the internal capsule. So yan, important to note. Posterior communicating, galing sa vertebral, internal capsule. Now for some clinical correlation, we have the common stroke presentations. So makikita natin dito sa image sa left, yung homunculi. And related dito, yung areas na sinusupply, areas ng cerebral cortex related to those parts of the body. And yung nagsusupply dun sa areas na yun, yung arterial supply ng areas na yun. So for the motor, makikita natin na itong area ng cerebral cortex na for the trunk, leg, and foot ay supplied by the anterior cerebral artery. Pagdating naman dito sa gilid, yung most of the side, yung arm, hand, face, tongue, middle cerebral artery na yan. Sa sensory naman, halos ganoon din. Anterior, yung trunk, leg, foot, genitals. Si middle, yan dyan yung arm, hand, face, and tongue. So, anong ibig sabihin nito? Kapag tinamaan tong arteries na to, yun yung mga structures or yun yung parts ng body na ma-affect. So, anterior cerebral artery, sabi natin, trunk, leg, foot. So, motor and sensory cortices of the lower limb kasi yung sinusupply ni anterior cerebral artery. So, ang presentation, contralateral paralysis and sensory loss ng lower limb. Si middle cerebral artery, upper limb and face. So, contralateral paralysis and sensory loss ng face and upper limb. Tapos, dahil si middle cerebral artery rin ang nagsusupply sa temporal lobe and most of the frontal lobe, pwede kang magkaroon ng aphasia and hemi-neglect kapag natamaan siya. Si posterior cerebral artery, occipital lobe yung mas sinusupply niya, itong green area dito. So, it's more of the visual disturbance. Now, let's discuss the venous drainage of the brain, which are your sinuses. So here we have your superior sagittal sinus, which is found at the fixed upper border of the falx cerebri. So imagine nyo nandyan yung falx cerebri. Yan. Next, we have your inferior sagittal sinus. Siya yung nasa free lower border ng falx cerebri. Next, you have your straight sinus, ito, which is at the junction of the falx cerebri and the tentorium cerebelli. And is also the union of the inferior sagittal sinus and the great cerebral vein. So, ito yung great cerebral vein. Great cerebral vein. Then, from the straight sinus, you have your right and left transverse sinuses. So, si right, interestingly, galing siya sa superior sagittal sinus, pero si left, galing siya sa straight sinus. And lastly, you have your sigmoid sinus. So, galing siya sa transverse sinus, mapupunta yung blood, papunta sa sigmoid sinus. Then, from the sigmoid sinus, pupunta na sa internal jugular. Another important sinus is your cavernous sinus. So, this here is your cavernous sinus. Kapag hinati mo siya dito sa area na ito, sa gitna, ito yung cross-section niya. So, ito yung cavernous sinus. And the cavernous sinus, makikita natin based on these pictures, yung boundaries niya. So, anteriorly, it extends into the medial end of the superior orbital fissure. So, ito. Yan. Nag-extend siya, papunta sa superior orbital fissure. Yung posteriorly, it's up to the apex of the petrous part of the temporal bone. So, ito yung petrous part ng temporal bone. So, nag-extend siya papunta doon. Medially, you have the pituitary above. So, pag tignan mo siya medially, ito yung pituitary, di ba? Pituitary above and the sphenoid, sphenoid bone below. Laterally, you have the temporal bone and the uncus. Yan. Superiorly, you have the optic chiasm. And inferiorly, you have the endosteal dura mater and the greater wing of the sphenoid. So, bakit important si cavernous sinus? Kasi marami siyang important structures na related sa kanya. First, you have your internal carotid artery and your abducens nerve. So ito si internal carotid artery, ito si abducens nerve, and they travel through the cavernous sinus. Meron ding structures na nasa may lateral wall niya. You have ito, yung mga nasa gilid na to. So you have oculomotor, your trochlear, your ophthalmic division of the trigeminal, and your maxillary division of the trigeminal. The pituitary gland, again, lies medially to the cavernous sinus. Your superior ophthalmic vein and central vein of the retina are found anterior to the cavernous sinus, and actually they drain into the cavernous sinus. The veins of the face are connected to the cavernous sinus via the facial vein and the superior ophthalmic vein. Your superior and inferior petrosal sinuses are connected with the cavernous sinus posteriorly. So ito na yung, kung titignan niyo dito, ito na yung petrosal sinuses. Your transverse sinus drains the cavernous sinus via the petrosal sinuses. And of course, your sigmoid sinus also drains it via the inferior petrosal sinus. So, clinical correlation. Kapag may infection ka of the orbit, nasal sinuses, and this danger triangle of the face, dahil sa connection ng cavernous sinus with the facial vein, pwede kang magkaroon ng cavernous sinus thrombosis. At kapag na-damage yung pag nagkaroon ka ng cavernous sinus thrombosis, madadamage yung structures na pinag-usapan natin kanina, such as your internal carotid artery and your abducens, which travel through the cavernous sinus, and your oculomotor, trochlear, and V1 and V2, which which are found on the lateral wall of the cavernous sinus. So dahil sa structures na yan, ang features ng cavernous sinus thrombosis, severe headache, particularly around one eye, swelling and bulging of the eye and surrounding tissues, pain and numbness around the face or eyes, double vision, and inability to move the eye. And last clinical correlation, you have intracranial hemorrhage. So for intracranial hemorrhage, you have 4 types. Your extradural, or epidural, your subdural, your subarachnoid, and your cerebral or intracerebral hemorrhage. Ang important thing maalala dito sa mga to ay kung anong vessels yung affected. So for extradural, ang affected dyan ay yung middle meningeal artery. Saan uli yan nakikita? Saan siya dumadaan? Sa foramen spinosum. And it's actually due to injuries at that terion. So ano yung terion? Yan yung junction ng frontal bone, parietal bone, temporal bone, and the greater wing of the sphenoid. Dito siya. So pag may blow dyan, pwedeng ma-damage si middle meningeal artery. Magpupool yung blood between the skull bone and dura mater, and kapag nakita mo sa CT scan, it's convex shape. So again, middle meningeal artery kapag extradural. Pag subdural, ano yung mga nasisira? It's the superior cerebral veins at their point of entrance into the superior sagittal sinus. These are also called your bridging veins. Kapag si bridging veins, subdural. And kapag si subdural, nasa gitna siya ng dura and arachnoid mater. So concave siya or crescent shape. Ngayon, anong injury yung magkakos ng subdural? Usually a blow to the back of the head. So, blow to back of head. Again, pag blow to the back of the head, bridging veins. Subdural hemorrhage. Next, you have your subarachnoid hemorrhage. So, pag subarachnoid hemorrhage, it's usually a leakage or rupture of an aneurysm. So, pwedeng berry aneurysm on the circle of Willis. So, subarachnoid, so it's between the arachnoid and pia mater. So, ang nangyayari dyan is hyperattenuation around the circle of Willis. So, nagpool na yung blood dun sa area na yon. So, hyperattenuated yung area na yon. And lastly, you have your cerebral hemorrhage. And for cerebral hemorrhage or intracerebral hemorrhage, it's a rupture of your lenticulostriate artery of the middle cerebral artery. So dito na siya sa loob. Yan. Loob-loob na yung hemorrhage na yan. So it's within the brain parenchyma. And kung nandun siya sa brain parenchyma, edi yung nag-hyperattenuate ay yung brain parenchyma. Now we go to the face. So for the face, we'll discuss the muscles of facial expression. Remember that all of these are derived from the second pharyngeal arch. And kapag second pharyngeal arch, ang associated nerve ay yung facial nerve. So you have your occipitofrontalis, which is surprise, yung yung emotion na kino-convey. And again, the occipitofrontalis, ano yan nakikita? Sa aponeurosis layer ng scalp. So again, di ba, meron kang epicranial aponeurosis. So, anong nangyari? Ito yung epicranial aponeurosis nyo. Epicranial aponeurosis. Ito yung frontalis. Naka-attach siya doon. Tapos, ipupul niya yung skin dito sa area na to, pataas. So again, nakikita siya sa aponeurosis. You also have your orbicularis oculi for winking, your corrugator supercilii for worry. Ito? Yan. Worry. Your procerus dislike. Yan, procerus. Your nasalis for alar flaring, orbicularis oris for kissing, zygomaticus for smiling, buccinator for your blowing or sucking. So, yan. Risorius for grinning, mentalis for doubt or sad, pabebe, pwede. And your platysma for tension or stress. Again, all are innervated by the facial nerve. For muscles of mastication, they are derived from the first pharyngeal arch. And that means that they're supplied by the mandibular division of the trigeminal nerve. So, si first pharyngeal arch, mandibular nerve. Si second pharyngeal arch, facial nerve. At ang muscles of mastication, you have your temporalis masseter and medial pterygoid, which close the jaw, and your lateral pterygoid, which open the jaw. So, pag sinabi nyo siya, so yung pterygoid yung magkaiba, diba? Si medial, closes, si lateral, nag-open. So, lateral, go-open ng jaw. Para lang matandaan. So, for nerve supply to the face, so, di ba, nabanggit na tayong dalawa. You have trigeminal nerve, which is V3, and your facial nerve. So, sensory innervation, the trigeminal nerve provides the general sensation for the face. So, skin of the face from trigeminal. And actually, it also gives general sensation to the anterior 2/3 of the tongue. While your facial nerve provides special sensation to the anterior 2/3 of the tongue. Yun yung sensory ng facial nerve sa face. Ang motor innervation ng trigeminal nerve, sabi na natin kanina, yung muscles of mastication, temporalis, masseter, and your medial lateral pterygoid. And yung sa facial nerve, it's the muscles of facial expression. Just some more detail about the trigeminal nerve and its sensory innervation. Makikita natin sa picture na to na may specific areas na sinusupply sa face yung tatlong division. So, your ophthalmic nerve, dito siya sa may scalp, forehead, hanggang sa tip of the nose. Kaya sabi na V1, pwede mo ilagay yung finger mo dito, V1. V2, dito siya sa sides, from the side. So, maxillary nerve, so sa may maxillary bone. So, dito sa area na to. And syempre, mandibular nerve sa may mandible. So, dito sa lower lip hanggang dito sa may sides ng face. Important to note na hindi nakikita masyado dito, pero kung i-extend natin tong jawline ni Kuya, yan, dito, hindi na yan actually supplied by the mandibular nerve. Cervical nerve na yung nagsusupply dyan. Or the superficial cervical plexus. Cranial, cervical nerves yung dito sa likod. The mandibular nerve can also be divided into an anterior division and a posterior division. Si anterior division, siya yung motor sa muscles of mastication. Si posterior division, siya yung sensory. So, anterior is motor, posterior is sensory. Now, let's talk about the facial nerve. Sabi nga natin, lumalabas siya sa CNS through the sa pontomedullary junction. After that, it gives off important branches. So, isa doon ang greater petrosal nerve, which supplies the lacrimal gland. So, lacrimation is facial nerve. Ang isa pang important after that na ginigive off niya, yung nerve 2 stapedius. And the stapedius is a muscle that dampens the vibrations of the stapes, preventing hyperacusis. After that, it gives off the chorda tympani nerve. So, yung chorda tympani, it provides the special sensation to the anterior 2/3 of the tongue and the floor of the mouth, but it also supplies the submandibular and sublingual glands. So, secretomotor fibers, so salivary secretion. After that, dadaan na siya sa stylomastoid foramen. So, pagdaan niya sa stylomastoid foramen, na-discuss natin kanina, gigive off niya yung posterior auricular nerve. I-give off din niya yung nerve to the posterior belly of the digastric, the nerve to the stylohyoid, and tsaka siya divide into its terminal branches. Now, the terminal branches, remember, they lie between the superficial and deep parts of the parotid, and they emerge at the anterior border of the parotid gland. And they innervate the muscles of the face. So you have your temporal, zygomatic, buccal, marginal mandibular, and cervical branches. So clinical correlation, you have Bell's palsy, which is peripheral facial nerve involvement. When you say peripheral, so outside na siya nung anatomic level na central nervous system. At ang effect niyan ay paralysis of the muscles of facial expression, dahil naapektuhan yung terminal branches ng cranial nerve 7. Affected din si chorda tympani. So dahil affected si chorda tympani, wala kang special sensation sa anterior two-thirds ng tongue at saka dry yung mouth kasi affected yung submandibular and sublingual glands. And you don't have tears because lacrimation again sa greater petrosal nerve. And you have hyperacusis because you denervate the stapedius. Kasi kapag yan yung peripheral. So this is a lesion in the facial nerve. So ang affected talaga yung half of the face. Kapag central lesion kasi siya, if it's a supranuclear lesion, the contralateral part also provides innervation to the ipsilateral part. So ito, makikita nyo, meron ding innervation towards the upper half of the face. So hindi completely mawawala yung facial expression dun sa side na yun. Another one for trigeminal nerve naman, you have your trigeminal neuralgia or tic douloureux. So, dahil na-affected si trigeminal nerve, affected yung areas na sinusupply niya for sensation. So, V1, V2, and V3. So, dahil nandito siya sa area na yan, it's triggered by moving the mandible, smiling, yawning, or cutaneous stimulation. So, pwede siyang dahil sa interrupted blood supply to the trigeminal ganglion. Now we go to the venous drainage of the face. So, yung venous drainage, it's the facial vein. So, sa artery, it's the facial artery. It's formed by the union of the supratrochlear, so ito, supratrochlear, and your supraorbital vein. So, pag nag-unite sila, ito na, the facial vein. And it communicates with the anterior division of the retromandibular vein. So, ito yung retromandibular vein, mag-split siya into the posterior and anterior division, at mag-unite yan with the facial vein to form the common facial vein, itong maliit na part na to. And the common facial vein then ends to drain into the internal jugular veins. The internal jugular vein. Again, the retromandibular vein naman is a union of the superficial temporal vein, ito, and the maxillary vein. So and it divides again into so ito na yung retromandibular, and it divides into an anterior and posterior branch. The anterior magjo-join nga sa facial vein to create the common facial vein, to form the common facial vein. Yung posterior branch naman, it joins the posterior auricular vein, which is this one, to form the external jugular vein. So again, ito yung magiging flow. Supraorbital vein and the supratrochlear magiging angular to facial vein. Ito yung important. Superficial temporal and maxillary magiging retromandibular. Magsisplit si retromandibular anterior posterior. Si posterior magsasali sa posterior auricular vein to form the external jugular vein. Si anterior magjo-join with the facial vein to form the common facial vein, which then drains into the internal jugular vein. And this is just a quick overview of the embryology of the face. Remember the pharyngeal arches, the pharyngeal folds, and the pharyngeal pouches. So the pharyngeal folds, yung nasa labas, it's ectodermal. The pharyngeal pouch is endodermal, and itong nasa gitna, these are all mesodermal. So bones and muscles. So si pharyngeal fold 1, it becomes the external auditory meatus. Si pharyngeal pouch 1 becomes the middle ear auditory tube. Si pharyngeal pouch 2 becomes the supratonsillar fossa. Si pharyngeal pouch 3 becomes the thymus and the parathyroid, the inferior parathyroids, and your pharyngeal pouch 4 becomes the thymus, the superior parathyroid glands, and the ultimobranchial body. Ang important din dito is yung pharyngeal arches, your 1, 2, 3, and 4, kasi iba yung artery na nanggagaling sa aortic arch na yan, iba yung cranial nerve na associated, and yung muscles and skeletal derivatives na associated. So si pharyngeal arch 1, is mandibular. It's supplied by the maxillary artery. It's innervated by the trigeminal. So ano yung na-discuss natin kaninang muscles na yun? It's the muscles of mastication. Ang skeletal derivatives are your ossicles, the malleus and specifically the malleus and incus, the mandibular ligament, and the Meckel's cartilage, which forms the mandible. Your hyoid arch or arch number 2, dyan manggagaling yung hyoid and your stapedial artery. It's supplied by the facial nerve, so muscles of facial expression. Ito na si stapes. Ito na yung styloid process, kaya si stylohyoid ligament din galing dyan, so yung stylohyoid muscle, and part of the hyoid cartilage. Pharyngeal arch 3, supplied by the internal carotid, supplied by glossopharyngeal, so 9. And yung kaisa-isang muscle, your stylopharyngeus, and your pharyngeal arch 4 is supplied by the vagus nerve, and your muscles would be your pharyngeal and laryngeal musculature, and it forms the laryngeal cartilage. Now let's go to the special organs of the head, starting with the eye. So first you have the orbit. So you have your orbital margins. Superiorly, it's the frontal bone. Laterally, it's the frontal and zygomatic processes. Inferiorly, it's the zygomatic bone and the maxilla. And medially, it's the maxillary and the frontal processes. For the walls, yun yung nasa loob nung orbit. So the roof is formed by the frontal bone and the lesser wing of the sphenoid. Laterally, it's formed by the zygomatic bone, the greater wing of the sphenoid. The floor is made up of the orbital plate of the maxilla and the zygomatic and palatine bones. And medially, it's the frontal process of the maxilla, the lacrimal bone, the ethmoid, and the body of the sphenoid. Let's go to the extraocular muscles. We have 7. You have the levator palpebrae superioris, you have the 4 recti muscles, and then you have the 2 obliques. So the levator palpebrae superioris acts to retract and elevate the upper eyelid. So kung may problem dyan, magkakaroon ka ng complete upper eyelid ptosis. Nakababa, hindi mo maangat. For the others, so the medial rectus acts to adduct, the superior rectus acts to elevate, the inferior rectus acts to depress, the inferior oblique is actually mainly functions for extorsion, but actually it elevates the eyeball. And for the superior oblique, it mainly acts for intorsion, but it actually depresses the eyeball. And the lateral rectus is for abduction. So, madaling tandaan dyan kung paano nag-work yung muscles is kung saan sila naka-attach. Kung titignan natin yung image na to, the superior rectus muscle, diretso siya naka-attach dun sa taas ng eyeball. So, kung ito yung eyeball mo, ito yung anterior. Tapos, kunwari ito yung superior rectus. Nakaganyan siya. So, kapag nag-pull tong muscle na to, nag-pull siya, angat. Si inferior rectus ganun din. Nakadikit siya dito sa baba. Pag nag-pull ka, bababa. Middle rectus, kapag nag-pull siya, pupunta siya medially. Tapos lateral rectus, dito siya. Pag nag-pull siya, laterally. Ngayon, si superior oblique tsaka si inferior oblique, bakit ganun yung action niya? So, superior oblique, actually, kung ito yung mata, tapos ito yung superior oblique, naka-sling siya around the trochlea. Ganun, kung titignan natin, naka-sling siya pa ganun. So, parang babalik siya. So, yung insertion niya actually medyo patagilid, tas palikod. So, kapag contract yung muscle, ang action niya is intorsion and depression. So, parang hinahatak kasi niya pababa, galing sa taas. And ganoon din si inferior oblique, galing naman sa baba. Pero nakaharap siya medyo palikod. So when it contracts, pataas yung action. To remember their innervation, just remember that the superior oblique is supplied by the trochlear nerve. Makes sense kasi nakasling around yung superior oblique muscle sa trochlea at trochlear nerve. Then you have your lateral rectus supplied by the abducens nerve. So 6, and all others are supplied by the oculomotor. For the vasculature of the orbit, the blood supply is mainly from the ophthalmic artery and the ophthalmic vein. And the branches of the ophthalmic artery include the central retinal artery, which is an end artery. And it supplies the optic retina. So, ano yung clinical correlate dyan? Kapag na-occlude si central retinal artery, magkakaroon ng cessation ng blood flow. At dahil terminal branch siya, it causes instant and total blindness. So, presentation niya, sudden, painless, unilateral vision loss that occurs over seconds. This is just a summary of the optic pathway and the visual field defects. So, tandaan natin na kapag yung mga nakikita natin sa, for example, sa left side, ay napupunta sa may nasal part kapag sa left eye. Tapos kapag sa right eye, napupunta siya sa may temporal part. Ngayon, kapag naman yung mga images na galing sa right side, pag sa right eye, napupunta siya sa nasal part. Kapag naman sa left eye, napupunta siya sa temporal part. So, tas yung path ay yung temporal sa both sides ay tuloy-tuloy lang sa optic nerve and optic tract, pero yung galing sa nasal sides ng both eye ay nagko-cross ng optic chiasm. Kaya kapag hiniwa natin dito, magkakaroon ka ng bitemporal hemianopia. Kaya siya bitemporal hemianopia kasi ang nawawala na nakikita ay yung nasa gilid. Yung nawawala ay nasa gilid. So this is a very useful diagram. Please study this. Now let's go to the tongue. So the tongue is a mass of striated muscle covered with mucous membrane. It's attached to the styloid process and the soft palate above and the mandible and hyoid bone below. So the tongue has three parts. You have the root, which is the posterior 1/3. You have the body, which is the anterior 2/3. And you have the apex. So the root is relatively fixed, which is attached to the hyoid and mandible, and is located in the pharynx. The body is the anterior 2/3, and it's extremely mobile, and it's located in the mouth. And you have the apex. It's also extremely mobile, and it's pointed anteriorly. So the tongue has two surfaces. So yung una, yung dorsum, is divided into a right and left part by the midline groove, which is here. So ito yung right and left. And it's characterized by the sulcus terminalis, so ito, this V-shaped groove. The apex points towards the foramen cecum, which is a remnant of the thyroglossal duct. And it divides the tongue into an anterior, so ito yung nasa oral cavity, and a posterior, which is nasa oropharynx. So the inferior naman, it rests against the floor of the mouth. Now, for the muscles of the tongue, you have intrinsic and extrinsic muscles. So you have the intrinsic muscles which alter the shape of the tongue, while the extrinsic muscles, they alter the position of the tongue. So, extrinsic, kasama dyan yung palatoglossus, styloglossus, hyoglossus, and genioglossus. And all of these are supplied by the hypoglossal nerve, except the palatoglossus, which is innervated by the vagus nerve. So the nerve supply of the tongue, medyo na-discuss na natin to kanina. Anterior 2/3, general sensation would be your trigeminal nerve. Special sensation would be your chorda tympani from the facial nerve. Sa likod, sa posterior 1/3, your general and special sense are both from the glossopharyngeal nerve. For the vasculature of the tongue, it's from the lingual artery, from the external carotid, di ba? Yung branches ng external carotid na na-discuss natin kanina. And your lingual vein, which drains into the internal jugular vein. For the lymphatic drainage of the tongue, very useful tong diagram na to. The apex of the tongue, itong area na to, goes to your submental lymph nodes. The anterior 2/3 is actually divided into a medial and lateral. Itong gitna, itong green na to, it goes to the inferior deep cervical lymph nodes, while the lateral parts go to the submandibular lymph nodes. Ang palatandaan ko dyan, submental, nandito yung lymph nodes na yon. So, it makes a bit of sense na yung nasa dulo ng tongue dito magde-drain. Yung sa gilid ng tongue ay sa submandibular lymph nodes nandito. Tapos tandaan na lang na yung gitna, yung medial part, ay sa inferior deep cervical lymph nodes. Tapos yung posterior 2/3, itong nasa likod, it goes to the superior deep cervical lymph nodes. Now let's go to the nose. So you have the walls of the nasal cavity. So let's discuss each wall. So first, for the medial wall, it's actually the nasal septum, which divides the nasal cavity into right and left halves. It has osseous and cartilaginous parts. So this is a picture, makikita natin, we have the cartilaginous part, which is the septal cartilage. And yung yellow dito, it's the yellow and the green and a part of the itong pink and purple, so the nasal crest of the so the maxillary bone, the palatine bone, the vomer, yung unpaired bone, and the perpendicular plate of the ethmoid bone all make up the osseous part of the nasal septum. Now, for the lateral wall, so yung lateral wall, maraming nangyayari dyan. Ang important is yung mga nasal concha. So the nasal concha sort of divides the lateral wall of the nasal cavity into recesses and meatusses. So above the superior nasal concha, So this is the superior nasal concha over here. Above it, you have the sphenoethmoidal recess. And the sphenoethmoidal recess drains your sphenoidal sinus. Your superior meatus is found below the superior nasal concha. So ito, yung superior nasal meatus. And it drains the posterior ethmoidal sinus. Below that, you have your middle nasal concha. Below the middle nasal concha, you have the middle meatus, and it actually drains a lot of structures. So you have the anterior ethmoid sinus, the middle ethmoid sinus, the maxillary sinus, and the frontal sinus. So all of those drain into the middle meatus. So, kapag tinanong tayo kung merong naging problem with the middle meatus, kunwari may blockage dyan, ito yung mga structures na ma-affect. Then, below the middle meatus, you have your inferior nasal concha, which sa loob niyan, nandyan yung inferior nasal concha. It's a separate bone, kung naalala natin kanina dun sa bones of the skull. And below the inferior nasal concha, you have your inferior meatus, which drains the nasolacrimal duct. So, siya lang yung mag-isang dinidrain sa inferior meatus. So, frontal maxillary, pareha yan nasa middle meatus. Then you have your roof. So the roof is formed by the cribriform plate of the ethmoid, the nasal, frontal, and body of the sphenoid, while the floor is made up of the palatine process of the maxilla and the horizontal plane of the palatine bone. So makikita natin dito, itong part na to sa baba, yan yung floor. Yan. Itong parts na nakaturo pa pataas, na nakadungaw pataas, part pa yan nung nasal septum. For the blood supply, it comes from 5 sources. You have your anterior ethmoidal artery, the posterior ethmoidal artery, the sphenopalatine artery, the greater palatine artery, and the septal branch of the superior labial artery. So, dalawa galing sa ophthalmic, dalawa sa maxillary, and isa sa facial artery. And what's important is that they have anastomosis. They meet here at the Kisselbach's plexus. So kapag meron kang nosebleed, anterior yung nosebleed, it's mostly bleeding from the Kisselbach plexus. Yan. So site of epistaxis. And lastly, you have the ear. So it's divided into the outer, middle, and inner ear. So for the outer ear, you have the auricle. And then you have the external auditory meatus, itong external auditory canal. So the auricle is made up of elastic cartilage, tanan elastic, and it's covered by skin. Innervations marami. So it's from the vagus and facial nerves, the greater auricular nerve, trigeminal nerve, and even the lesser occipital nerve. Sa external auditory meatus, tandaan na its external 1/3 is cartilaginous and its internal 2/3 is bony. Actually, parang sa nose, di ba? Nasa harap yung cartilage, tapos nasa likod yung osseous part. So parang ganun din sa external auditory meatus. And for innervation, the trigeminal nerve, the facial, vagus, and glossopharyngeal nerves. Separating the outer ear and the middle ear, you have your tympanic membrane. In the tympanic membrane, what's important here is that the cone of light is reflected starting at the umbo, is seen at the antero-inferior quadrant. So kapag nakita natin to, nakaturo siya sa antero-inferior quadrant. So alam natin na right tympanic membrane to. For the innervation, the innervation of the external surface is, ito yung nabanggit natin kanina, yung merong trigeminal, facial, vagus, and glossopharyngeal nerve. Kapag yung internal surface naman, it's just the glossopharyngeal nerve. So kapag pag tinanong kung ano yung innervation sa loob, it's just cranial nerve 9. Sa labas, 5, 7, 9, at 10. After the tympanic membrane, syempre, pasok tayo sa middle ear, which is found in the petrous part of the temporal bone. So it's split actually into a tympanic cavity proper, and which is a space directly internal to the tympanic membrane, and an epitympanic recess. So nakaturo dito, ito yan, epitympanic recess, which is space superior to the tympanic membrane. So the contents of the middle ear, you have your auditory ossicles, you have your malleus, incus, stapes, you have your stapedius, which is supplied by the facial nerve, and your tensor tympani, which is supplied by the mandibular division of the trigeminal. You have your chorda tympani nerve and your tympanic plexus of nerves. One important thing here is the walls of the tympanic cavity and their relationships. So you have the tegmental wall. So over here is the tegmental wall, which is the roof, which is formed by the tegmen tympani. Remember, the tegmen tympani separates the tympanic cavity from the dura mater on the floor of the middle cranial fossa. Again, the tegmen tympani separates the tympanic cavity from the dura mater. Then you have the jugular wall, which is the floor. It separates the tympanic cavity from the internal jugular vein. You have the membranous wall, which is lateral. So, kaya siya membranous kasi nandyan si tympanic membrane. It's formed by the tympanic membrane and the bony wall of the epitympanic recess. Next, you have your labyrinthine wall. So, itong mas medial. It separates the tympanic cavity from the inner ear. It contains the promontory, the oval window, and the round window. You have your mastoid wall, which is posterior. Itong nasa likod, itong yellow na wall. It contains the additus or opening. So ito, additus. Yan, ito yan. Yung binubulugan ngayon. That's the additus. It's opening into the mastoid antrum. And it has the canal for the facial nerve, which descends between the posterior wall and the antrum. And lastly, you have your carotid wall, which is anterior. So dito sa image na to, nakatanggal yung carotid wall. It separates the tympanic cavity from the carotid canal. So superiorly, it has the opening of the pharyngotympanic tube and the canal for the tensor tympani. And lastly, you have the inner ear. So for the inner ear, you divide it into the bony labyrinth and the membranous labyrinth. The bony labyrinth consists of the vestibule, the 3 semicircular canals, and the cochlea. And the bony labyrinth contains your perilymph. So ito yung bony labyrinth. Next, you have your membranous labyrinth, which is contained inside the bony labyrinth, and it contains your sensory organs. You have your maculae, utricle, and saccule for linear acceleration, your ampullae of the semicircular ducts for angular acceleration, and your organ of Corti located in the scala media for hearing. And it's filled with endolymph. And that's it for the head.